Tadalafil is a phosphodiesterase 5 inhibitor used to treat erectile dysfunction, benign prostatic hyperplasia, and pulmonary arterial hypertension. In this video, let's find found. What is Tadalafil? What is Tadalafil used for? Contraindication. What are the side effects of taking Tadalafil? How does Tadalafil work? How to use Tadalafil? What is Tadalafil? Tadalafil, sold under the brand name Cialis among others, is a medication used to treat erectile dysfunction, benign prostatic hyperplasia, and pulmonary arterial hypertension. It is taken by mouth. Onset is typically within half an hour and the duration is up to 36 hours. Tadalafil was approved for medical use in the United States in 2003. It is available as a generic medication. In 2020, it was the 261st most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is Tadalafil used for? Tadalafil is indicated for the treatment of erectile dysfunction, ED, and either alone or in combination with finasteride for the treatment of benign prostatic hypertrophy, BPH. It is also indicated for the treatment of pulmonary arterial hypertension, PAH, both alone and in combination with macitentan or other endothelin 1 antagonists. Contraindication. Tadalafil is contraindicated for patients known to have ever had an allergic reaction to Tadalafil or any other medicine, are taking medicines called nitrates for chest pain, angina, have a serious heart or liver problem, have recently had a stroke, heart attack or a heart problem. Your doctor should carefully check whether your heart can take the additional strain of having sex, have low blood pressure, hypotension, have a rare inherited eye disease, such as retinitis pigmentosa, have sickle cell anemia, an abnormality of red blood cells, leukemia, cancer of blood cells, or multiple myeloma, cancer of bone marrow, have a deformity of your penis or Peyronie's disease, curved penis, have a stomach ulcer, have a bleeding problem like hemophilia. Side effects. The most common potential side effects when using Tadalafil are headache, stomach discomfort or pain, indigestion, burping, acid reflux, back pain, myalgia, pain in limbs and extremities, flushing, hypertension, or uncommonly hypotension, and stuffy/runny nose. Also common are dizziness, peripheral edema, fatigue, and urinary or respiratory tract infection. Both diarrhea and constipation have been reported. Pharmacodynamic. Tadalafil exerts a therapeutic effect in ED by increasing sexual stimulation-dependent smooth muscle relaxation in the penis, allowing the corpus cavernosum to fill with blood to produce an erection. Smooth muscle relaxation in the pulmonary vasculature helps to produce vasodilation (PAH), which reduces blood pressure in the pulmonary arteries. In BPH, Tadalafil may contribute to decreased smooth muscle cell proliferation, which may reduce the size of the prostate and relieve the anatomical obstruction which produces urinary symptoms of BPH. The decreased affinity of Tadalafil for PDE6 compared to other PDE5 inhibitors may explain the reduced incidence of visual side effects. Mechanism of action. Tadalafil is a selective phosphodiesterase 5, PDE5, inhibitor that produces several downstream effects, with the most common therapeutic effect being smooth muscle relaxation. Patients may experience ED due to a variety of causes including psychogenic, neurogenic, vasogenic, iatrogenic, or endocrine. These causes result in dysfunction of penile smooth muscle relaxation through either disrupted neuronal signaling or direct influence on smooth muscle cells. During sexual arousal, noradrenergic noncholinergic (NANC) neurons release nitric oxide (NO). Nitric oxide stimulates guanylate cyclase, which converts guanosine triphosphate to cyclic guanosine monophosphate (cGMP). cGMP activates the cGMP-dependent kinase (PKG) in a signal cascade which activates K+ channels, leading to inhibition of Ca2+ channels, platelet activation, and inhibits smooth muscle cell proliferation while inducing apoptosis. This signal cascade is attenuated by PDE5, which breaks the phosphodiester bond of cGMP, converting it to GMP. Inhibition of PDE5 by tadalafil increases signaling via the PKG cascade, which is penile smooth muscle relaxation during sexual arousal by decreasing Ca2+ entry into smooth muscle cells. This smooth muscle relaxation allows blood to fill the corpus cavernosum, thereby producing an erection. In PAH, blood pressure in the pulmonary arteries is raised due to a variety of mechanisms stemming from endothelial dysfunction. Lastly, tadalafil is used to treat BPH. BPH produces urinary dysfunction through hyperproliferation of the epithelial and smooth muscle layers of the prostate. The increased size of the prostate blocks urine flow through the urethra, resulting in higher residual volumes to incomplete emptying. Tadalafil does not appear to exert its benefit by a smooth muscle relaxation of the prostate. It may instead exert its effect through a mix of increased oxygenation and decreased inflammation, which decreases tissue remodeling, and inhibition of cell proliferation through the cGMP cascade. Mechanism of action. Tadalafil is a selective phosphodiesterase 5, PDE5, inhibitor that produces several downstream effects, with the most common therapeutic effect being smooth muscle relaxation. Patients may experience ED due to a variety of causes, including psychogenic, neurogenic, vasogenic, iatrogenic, or endocrine. These causes result in dysfunction of penile smooth muscle relaxation through either disrupted neuronal signaling or direct influence on smooth muscle cells. During sexual arousal, nonadranergic noncholinergic, NANC, neurons release nitric oxide, NO. Nitric oxide stimulates guanylate cyclase, which converts guanosine triphosphate to cyclic guanosine monophosphate, cGMP. cGMP activates the cGMP-dependent kinase, PKG, in a signal cascade which activates K+ channels, leading to inhibition of Ca2+ channels, platelet activation, and inhibits smooth muscle cell proliferation while inducing apoptosis. This signal cascade is attenuated by PDE5, which breaks the phosphodiester bond of cGMP, converting it to GMP. Inhibition of PDE5 by tadalafil increases signaling via the PKG cascade, which is penile smooth muscle relaxation during sexual arousal by decreasing Ca2+ entry into smooth muscle cells. This smooth muscle relaxation allows blood to fill the corpus cavernosum, thereby producing an erection. In PAH, blood pressure in the pulmonary arteries is raised due to a variety of mechanisms stemming from endothelial dysfunction. Lastly, tadalafil is used to treat BPH. BPH produces urinary dysfunction through hyperproliferation of the epithelial and smooth muscle layers of the prostate. The increased size of the prostate blocks urine flow through the urethra, resulting in higher residual volumes to incomplete emptying. Tadalafil does not appear to exert its benefit by a smooth muscle relaxation of the prostate. It may instead exert its effect through a mix of increased oxygenation and decreased inflammation, which decreases tissue remodeling, and inhibition of cell proliferation through the cGMP cascade. Dose. Erectile dysfunction. Indicated for treatment of erectile dysfunction, ED. Cialis or generic equivalent only. PRN use, 10 mg PO initially before sexual activity, with or without food, may be increased to 20 mg or reduced to 5 mg on basis of efficacy and tolerability. In most patients, maximum dosing frequency is once daily. Once daily use, 2.5 mg per day PO in single daily dose, without regard to timing of sexual activity, with or without food, may be increased to 5 mg per day on basis of efficacy and tolerability. Benign prostatic hyperplasia. Indicated for treatment of signs and symptoms of benign prostatic hyperplasia, BPH. Daily use also indicated for treatment of patients with both BPH and erectile dysfunction. Cialis or generic equivalent only. BPH, 5 mg PO once daily. BPH with ED, 5 mg PO once daily, taken at approximately same time each day, without regard to timing of sexual activity. Co-administration with finasteride for BPH, tadalafil 5 mg plus finasteride 5 mg PO daily for less than or equal to 26 weeks, Incremental benefit of Tadalafil decreases from 4 weeks until 26 weeks, and the benefit beyond 26 weeks is unknown. Pulmonary arterial hypertension. Indicated for pulmonary arterial hypertension, PAH, WHO Group 1, to improve exercise. Studies establishing effectiveness included predominantly patients with NYHA functional class 2, 3 symptoms and etiologies of idiopathic or heritable PAH, 61%, or PAH associated with connective tissue diseases, 23%. Adcirca, Alic, Tadalafil, or GEN equivalent only. 40 mg PO once daily, dividing dose for more frequent dosing is not recommended. Patients also taking ritonavir, 20 mg PO once daily initially for greater than or equal to 1 week, may be increased to 40 mg per day on basis of tolerability. Dose. Erectile dysfunction. Indicated for treatment of erectile dysfunction, ED. Cialis or generic equivalent only. PRN use, 10 mg PO initially before sexual activity, with or without food, may be increased to 20 mg or reduced to 5 mg on basis of efficacy and tolerability. In most patients, maximum dosing frequency is once daily. Once daily use, 2.5 mg per day PO in single daily dose, without regard to timing of sexual activity, with or without food, may be increased to 5 mg per day on basis of efficacy and tolerability. Benign prostatic hyperplasia. Indicated for treatment of signs and symptoms of benign prostatic hyperplasia, BPH, daily use also indicated for treatment of patients with both BPH and erectile dysfunction. Cialis or generic equivalent only. BPH, 5 mg PO once daily. BPH with ED, 5 mg PO once daily, taken at approximately same time each day without regard to timing of sexual activity. Co-administration with finasteride for BPH, Tadalafil 5 mg plus finasteride 5 mg PO daily for less than or equal to 26 weeks. Incremental benefit of Tadalafil decreases from 4 weeks until 26 weeks, and the benefit beyond 26 weeks is unknown. Pulmonary arterial hypertension. Indicated for pulmonary arterial hypertension, PAH, WHO Group 1, to improve exercise. Studies establishing effectiveness included predominantly patients with NYHA functional class 2, 3 symptoms and etiologies of idiopathic or heritable PAH, 61%, or PAH associated with connective tissue diseases, 23%. Adcirca, Alic, Tadalafil, or GEN equivalent only. 40 mg PO once daily, dividing dose for more frequent dosing is not recommended. Patients also taking ritonavir, 20 mg PO once daily initially for greater than or equal to 1 week, may be increased to 40 mg per day on basis of tolerability. That's all the information about Tadalafil we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.